Welcome to Unit 17 in Cardiovascular Part 1 series for Anatomy and Physiology 1 students. There are 3 chapters in our lab manual for the cardiovascular system. In the first of these 3 chapters, Unit 17, 18, and 19, we're going to be talking about the heart first. And in the next 2 chapters, we're going to be talking about the blood vessels, the vascular component, and some of the cardiovascular physiology. So for this chapter, we're mainly interested in finding out about the normal structure, anatomy of the heart, where it's located, what it's doing, how the blood flows through the heart, and a little bit more about the cardiac conduction system and related information. Now, when you're trying to visualize where the heart is actually located in the body, keep in mind the heart sits in the middle of the chest at the mediastinum, which is that area within the thoracic cavity in the chest. On each side of the heart are the lungs, the right and left lung. Obviously, they are surrounded also by a few blood vessels and other structures, but the primary components of the thoracic cavity are the heart, again in the middle, pointing to the left slightly, and the lungs on each side as part of the pulmonary system. Now, if you imagine sort of dissecting or doing surgery on a person and opening up the chest, cutting through the sternum and trying to access the heart itself, you would see first that the heart is actually covered by the protective sac called the pericardium. There's some pericardial fluid that is between the pericardium and the outer wall of the heart, just a few, about 20-30 ml at most. Once you cut through the pericardium, you expose the heart itself, and the heart is primarily consists of myocardium, that's the main heart muscle. Individually, these are cardiomyocytes, the heart muscle cells, and then we also have names for different areas as part of the external or internal wall, and the more important one, the internal wall where the blood would actually be touching sort of the heart, is the endocardium component. Again, the main heart wall is the myocardium. Now, our heart, the mammalian heart and the human heart, consists of 4 chambers and 4 valves. 4 chambers essentially means there are 2 chambers on top, 2 chambers on the bottom. The heart can be thought of as having a right and left sides. The right and left sides are not symmetrical. As we go through the blood flow and naming of the structures, you'll see that even though they are named the same, they actually do not do exactly the same thing. And the way the blood flow travels through those areas is somewhat different, and just something to keep in mind. Now, the 2 upper chambers of the heart are called the atria. So there's a right atrium and left atrium, and the 2 bottom chambers are called the ventricles, the right and left ventricles. Now, the ventricles are much bigger than the atria. They have thicker muscular wall. They do actually apply more force to pump the blood through the system. And the atria usually do less of the pumping and usually receive blood either through gravity or basically through kind of a more passive means. Now, in order for the blood to properly flow through all these chambers and to get into the heart and out of it, you have to keep in mind the blood needs to go through only in one direction. We do not want our blood flow to reverse and start going back, right? So in order to do that, we have these 4 valves that are located inside the heart that allow for the blood to go only in one direction. And if the blood tries to go the other way, the valves will basically close, not allowing the blood to go back. Okay, so valves kind of could be thought of as like sort of doors or windows that open, letting the blood pass into the next chamber or next blood vessel, and then will quickly close behind it to make sure the blood does not reverse itself or go the wrong way. So now, as you're watching this, make sure you're looking at the illustrations in the lab manual for the heart anatomy and seeing where all of these structures are actually located. Now, let's talk about these 4 valves. So the first valve, the largest valve in the heart, is the tricuspid valve, meaning it has these 3 cusps or these 3 flaps. This valve is located between the right atrium and the right ventricle in the heart. So when the blood flows from the right atrium into the right ventricle, it has to pass through the tricuspid valve. The next, through anatomical location, the next valve is the pulmonic or the pulmonary valve. This valve is located between the right ventricle and the pulmonary trunk, which is this large artery that exits out from the right ventricle on its way towards the pulmonary circulation, or basically the lungs. Again, the pulmonic valve is located between the right ventricle and the pulmonary trunk. The other two valves are going to be now on the left side of the heart. Right? Keep in mind, tricuspid pulmonic were on the right side of the heart. Aortic mitral valve are going to be on the left side. Now, the mitral valve is also, which is called bicuspid, by the way. It has two cusps. Bi means two. This valve, the mitral, is located between the left atrium and the left ventricle. So when the blood needs to flow from the left atrium into the left ventricle, it will pass through the mitral valve. Right? Again, mitral valve opens up, blood goes down into the left ventricle. Okay, that's the process. Now, just to keep this kind of in mind also, both the tricuspid and mitral valve are the largest of the valves. These are the what's called AV valves, or atrioventricular valves. And the other two valves, the pulmonic and aortic, are what's called the semilunar valves. They're much smaller, sort of less complex. The last, again, valve, the aortic valve, is the one before you enter the aorta, which is the largest blood vessel here, the largest artery in the body that brings the blood to the rest of the body from the heart, exits out from the left ventricle. So when the blood needs to go from the left ventricle and out into the aorta, it actually passes through the aortic valve. Okay, so blood goes from the left ventricle through the aortic valve into the aorta and then on its way to the rest of the body. And in the next chapter, in Unit 18, Cardiovascular Part 2, we'll see that the vascular system, the blood vessels, will essentially be multiple branches from the aorta going into the neck, into the head area, arms, and the rest of the body, and kind of continues through it. And we'll see that how that is taking place. Now, a few other kind of connections and blood vessels we have to make with the heart. So when you look at these great vessels, right? So we named already the aorta, the pulmonary trunk, which is also called the pulmonary artery. But we didn't say how does the blood actually get to the heart from the venous system, right? So in the body we have arteries and veins. Arteries carry oxygenated blood, veins carry deoxygenated blood. Deoxygenated means they have less oxygen, right? Fully oxygenated in arteries and less oxygenated or deoxygenated in veins. So as the blood is traveling through the body, at some point after all the oxygen has been distributed to all the cells, that blood now has to return, get back to the heart so the cycle can continue. Right, so that venous return back to the heart happens thanks to these two large veins, SVC and IVC, that join into the right atrium of the heart. SVC stands for superior vena cava, IVC stands for inferior vena cava. So superior and inferior vena cava, these two largest veins in the body, connect from the top and the bottom into the right atrium, and that's how the blood flow begins in the heart. So again, from the right atrium, we pass through the tricuspid valve into the right ventricle. Then from the right ventricle, the blood goes to the lungs. So it passes through the pulmonic valve into the pulmonary circulation, goes to both lungs. In the lungs, the blood gets oxygenated, meaning picks up all the oxygen, or the hemoglobin in the red blood cells get the oxygen from those alveoli in the lungs. And then the blood flow now coming back into the left side of the heart. There's going to be these four pulmonary veins. These veins, two from each side, right, from each lung, will enter now the left atrium of the heart. Remember, the blood is now fully oxygenated. And then from the left atrium, the blood passes through the mitral valve or the bicuspid valve, goes into the left ventricle, and that final kind of contraction, final push that happens, the largest of the chambers, the left ventricle, contracts and pushes the blood up through the aortic valve into the aorta and out of the heart to all the rest of the body. Now, just before the blood can continue much further in the aorta, there's actually these little entry points for the coronary arteries. These are the very important arteries that actually provide the blood to the heart itself, to the myocardium itself. Right? So the coronary arteries, there's three main ones. There's the RCA, LAD, and circumflex. So right coronary artery for the right side of the heart, left anterior descending artery for the left side of the heart essentially, and then for sort of the more kind of a posterior portion kind of going around is the circumflex artery, right? Like circumference around. So right coronary, left anterior descending, circumflex. These coronary arteries are extremely important for the survival, for the normal function of the myocardium, right? In order for the heart to do its job, obviously it needs to receive its own oxygen and all the nutrients, and this is provided by these coronary arteries. Now, there's a few other structural components and other important issues that we want to discuss here. So on the next page, we want to see the rest of the components here. Basically, the way I've been kind of divided this here very simply. Again, you'll find this information obviously in the book as well, in illustrations. So a few basic components. So when you're looking at the heart itself, the heart points, its pointy end, towards the diaphragm, to the bottom. Right? So that lowest portion of the heart is actually called the apex of the heart, right? Apex normally, remember, is the top of something, right? Like apex of the mountain. And actually that portion where the blood vessels are exiting out from the heart, like the aorta and others, that's actually the base of the heart, right? So base is usually the bottom, apex is the top, but the heart is kind of upside down in your chest. And so the apex is actually the bottom point. Okay. Other important components, when you're trying to find, for instance, the right atrium of the heart, you can do that easily by first finding the auricle of the right atrium. This is like a little ear, or a kind of a protruding portion over the right atrium on the outside of the heart. If you dissect through the heart, you would see that it has this interventricular septum, this important muscular thick component that separates the right and left ventricles in the heart. Kind of a good way to kind of orient yourself when doing a dissection or cutting through the heart, which you can see in illustrations in the book as well. And thinking about our different valves, especially those two large valves that we talked about, the tricuspid and bicuspid valves. Those two valves, because they're so large, right, they have either 3 or 2 cusps, they have little muscles and little connections, kind of like strings of a parachute that connect to the flaps. And the muscles are called papillary muscles, and those little strings are called chordae tendineae. So essentially, right, they're there to make sure to, when the papillary muscles pulls on the chordae tendineae, which are connected to the flaps, it allows the valves to open and close as the blood is passing through those valves. Again, this is only found in the tricuspid and the bicuspid or mitral valves. Now, another thing to keep in mind is that even though our hearts have this intrinsic capacity to contract, right? The heart is one of the essentially most important organs in the body. The heart starts working, starts pumping the blood very early on in the fetal development and continues to do that without breaks throughout the entire person's life until the last moment of essentially their death. And so in order to do that, multiple factors play a role in this process. Now, so even though, again, the heart has this intrinsic capacity, it actually does need to receive some signals from the nervous system. And most importantly, even, is that not only is there signals received, there's inside the heart is actually a cardiac conduction system or multiple electrical pathways that serve as pacemakers to allow the proper rhythm of the heart to be set. Now, we know that the heart, essentially the normal sinus rhythm of the heart is on average around 70 beats per minute, right, when you're checking someone's pulse. And so how is that rhythm set? Well, it's actually, there are 4 separate areas within the cardiac conduction system. In order to evaluate these, you would do an EKG or electrocardiogram. When you see those squiggly lines on the monitor or on a paper or printout, every time those squiggles kind of move, right, these are essentially indication of the electrical activity of the heart. So when a person is undergoing a 12-lead EKG, the 12 different points are measuring the electrical conduction through these different areas. the signal always goes in one direction. It starts at the primary pacemaker, the sinoatrial node, that fires. This is at the top of the right atrium. After that fires, the signal transmits through the atrium and goes into the AV node, or atrioventricular node. This is located approximately in the kind of inferior portion of the right atrium. Then the signal gets to kind of expand further and goes through the AV bundle or bundle of His, that's mostly located in the interventricular septum of the heart. And then as the signal progresses further down towards the apex of the heart, actually reaches these Purkinje fibers that distribute the signal, the electrical conduction further through the apex and the ventricles. Again, most important here, this is obviously a considerable kind of oversimplification of this complex process, but what we need to remember here, again, there are 4 steps here, 4 separate areas. The electrical signal, again, starts at the main pacemaker, SA node, goes to AV nodes, goes to bundle of His, goes to Purkinje fibers. And after that, again, we restart from the beginning. SA node, AV node, bundle of His, Purkinje fiber, and on like that. Again, in order to see this, you would see this through an EKG. Again, you don't need to interpret EKGs now, but keep in mind that, again, in the book, we do have illustration of this. You can see where these different cells are located and how this kind of electrical conduction is transmitted. In the next couple of chapters, we're going to look more at the physiology and the continuation of the cardiovascular system with the blood vessels and other components.